Welcome, Dr. Chuck Berg, Rivervale Chiropractic Center. Wanted to spend a few minutes today talking about a condition that in my work, I've been doing it now for 33 years, probably more than any other problem that we see in our office are people with lower back problems. Now, lower back issues are inordinately common. The worker compensation statistics tell us that almost 9 out of 10 people will at one point in their life experience back problems. What you as a layperson needs to understand is that your back problem is different from your neighbor's. So it's important not to try to understand this as a single problem, but rather understand that the lower back is a very complex area of the body, and it's going to hold up. 85% of your body weight falls through the lower back, specifically the last two lower back vertebrae, L4 and L5. I have a picture here, my plastic model, showing you what a swelling or bulging disc looks like. And this is a condition that's very common. Sometimes you'll notice people almost bent over to the side as they're walking due to the severe swelling that's taking place. A disc is something that needs to heal, obviously. The chiropractor's job is to find, locate, and remove the area of nerve irritation. Some people think it's as simple as just lying down, making a very specific adjustment, correcting, and pain should go away. While that happens on occasion, a true bulging or swelling disc is an inflammatory process. And folks, you must understand that an inflammatory process takes time in terms of healing. So recommendations that I can share with you as a lay audience is, number one, with most back conditions, don't sit. Sitting irritates the lower back. Sitting increases the pressure inside of the disc. Folks, think of it as a balloon. When you go to sit on the balloon, the side that's exposed just fills up with more air. And that's something that we don't want to do. So minimize sitting. You're almost better off to be walking about, and make sure that you initially, over the course of the first maybe even 24 to 72 hours, a great deal of ice to reduce the inflammation. We can get technical, and certain types of lower back problems require what we call a decompression type of movement. A movement where we allow the back to open up, and inside the disc it acts as like a vacuum to kind of suck back the disc material. It's something that doesn't happen immediately, but over the course of time. And I will say that usually the most severe of back problems, within a matter of a few days, sometimes even a full week, is what's necessary to almost feel back to normal again. So once again, the lower back, very, very common. You'll notice when you have a back injury, almost everything that you do is affected, from just reaching forward to sneezing to making a turn. We see how inordinately involved the human spine is. So if I can just make one recommendation, don't neglect your spine. Your spine is your lifeline. It connects the brain, the entire central nervous system, and 31 pairs of nerves exit to control and coordinate all of life's activity. I hope this is helpful. A little bit of tidbits, but most importantly, be kind to your spine. All right, it's your lifeline. Thank you.